again for joining us this afternoon. We're actually going to be talking through the fail-proof ways that you can master some of these COVID requirements with that moving variant target that we've seen that seems to be traveling everywhere. It's has caused some issues in its wake for sure. So for those of you who may be new, my name is Holly Foxworth. I'm one of the registered nurses here at Axiom, and I'm also the marketing manager for content here. And I have a fantastic panel to join us today. Actually, we've got, this may actually be one of the largest panels that we've ever brought on to one of these events, but I think it's so important for us to not only cover the medical piece, but also have people that are working in your environment and can speak to how these individual requirements and some of these recommendations can really be rolled out and you can implement those in a way that makes sense for you. So before we get started with all of that, there are several things I wanted to bring to your attention. So when you're looking at your screen there, the webinar screen, what you'll notice is that there's several things that are there. So there on the right-hand side at the very bottom, you'll see that that's what we call the Q&A section. So if there's any kind of questions that you come across, if there's anything that you want to ask that's related to COVID or anything that actually would be related to your individual production or anything it is that you have there, we are more than happy to take those questions and get you some answers. So feel free to type any of those questions in throughout the entire event. Usually we'll try to sprinkle in some that would be related to the individual slides that we go through. However, at the very end, we also have some time there that's going to be specific, dedicated for that Q&A at the very end. So anything you want to say, we love to hear it. We love to talk, obviously. And so we want to hear what it is that you want to share as well. The second piece is that right above where that Q&A section is, you'll notice that there is an icon there. It has some pictures, and actually that is the next event that we have scheduled for this next, it'll be 2 weeks from now, so it'll be the 7th of October. And so that one is actually about the additional funding that's been proposed, like $700 million in addition funding for some additional OSHA investigators. And so I'm sure that you guys have seen all of the headlines that have been covering all of these things about some of the new Biden updates, all of the regulations that are associated with that. And so this will focus on what that would look like and what those things are that some of the investigators would be looking for if they arrive on their location to do an inspection. So I know nobody likes to see them coming, but we definitely want to make for sure that you're prepared and would be able to answer all the questions that they would have and that you wouldn't be subjected to any type of fines that would be associated with that. So if there's anything that you'd like to join us for that one, obviously we'd love to have you. It is scheduled for 1:00 p.m. and that's on Central Time, 2 weeks from now on Thursday. The last thing I wanted to mention is that at the very bottom of your screen, you'll see that there is some icons, and one of those looks actually like a stack of books, and so that's what we call the resource tab. So in the resource tab, you'll find several things. Number one, obviously, is going to be a copy of today's slide deck that we go through. You're welcome to download that and look at it at another time. But in addition to that, there's some white papers. And so these are specific. We have one that's actually brand new. You guys will be the first ones that actually get to see it. And so it's related to the COVID mandates for Broadway and what it is that you're going to need to know about that. So if you'd like to look at those along with everything that's going to be related to managing flu during the pandemic or how it is that you can roll out a vaccination plan, et cetera, you're more than welcome to anything that's there. Those are all free of charge, and anything that we can do to help you along the way, we're more than happy to do so. All right, so I think that is the majority of the questions I wanted to kind of bring up here in the very beginning and draw your attention to. So what I would like to do at this point, though, is kind of transition and let our additional speakers that have joined our panel introduce themselves, tell you what it is that they do, who they work for, and how they're related to this topic and what's going on. So I tell you what, why don't we start with Dr. Scott Cherry. Dr. Cherry?
Good afternoon, everyone. My name is Scott Cherry. I'm Axiom Medical's Chief Medical Officer. My professional background is I'm board certified in preventive medicine, public health, and occupational environmental medicine. And I've been supporting corporate, industrial, and military operations for the past 15 years. And it's a pleasure to be with you today.
Awesome. Thank you for joining. And Derek, why don't we go to you next?
Great. Thank you, Holly. I'm really pleased to be here. And as everybody knows, things are changing very quickly and rapidly in this interesting time that we're living in. So please reach out and let us know if we can help. And we're here to talk about some of these topics today. Thanks, Holly.
Love it. Okay. Molly, we'll go to you next.
Hi there. My name is Molly Shea, and prior to the apocalypse, I had worked for nearly a decade in Broadway, off-Broadway, and live events as a stage manager. I'm actually still a card-carrying member of Actors Equity Association, and I've worked for organizations such as Ars Nova, New York Theater Workshop, and the Tony Awards. I have, in this apocalypse time, pivoted and been really excited by COVID compliance work in TV and film and for live events as well. It's a really great opportunity to take the organization and people management skills that I've developed and apply them to supporting creative processes in different ways. And it's been a really great eye-opener to make sure that we're supporting art and work and keeping people safe.
I love that. Thank you, Molly. Well, speaking of the Tony Awards, why don't we go over to Tony DeLetta?
Hey, good afternoon, everyone. My name is Tony DeLetta. I've worked here at Axiom for about 13 years. The last year of this, during the apocalypse, as Molly would say, I was helping out in Los Angeles with TV and film and COVID compliance. Once they returned to filming, as everyone knows, there was all these guidelines and regulations that were required in order to start back up. So Axiom was one of the pioneers to come into these sets and work with these stage managers, directors, producers, line producers, everyone all the way up to really find something that would work for them, their guilds, their unions, and everything in between. And I'm happy to be here today. Thanks so much.
Obvious. Thank you. That is fantastic. All right, let's go over to Alex.
Yeah. Hey, everybody. I'm Alex Freeman. I'm the regional sales manager at BroadwayWorld.com. I also run our industry pro section of the site. So in my day-to-day, I'm in conversation with theater leaders across the country and the world about the different challenges that they're facing, most of which for the last year and a half have been COVID related. So excited to kind of share what they've been talking about, what we found as best practices, and working with Axiom here to help you get those best practices to your organization.
Fantastic, Alex. And do we have Zach yet? Was Zach able to join? No? Okay, that's okay. All right, we'll pick Zach up maybe at a later time if he's able to get a connection and join us there. All right, well, we'll go ahead and just get started here. Before we do so, I did want to kind of give you an idea of what it is that we're going to kind of go through systematically in this event, the information that we want to cover. So we'll start with Dr. Cherry giving us an idea of, kind of where we stand with COVID-19. What does that long-term trajectory look like? And how is it that this Delta variant really has taken an impact not only on our day-to-day life, but obviously in our working life as well. So we'll cover that. We'll cover the 4 principles that are listed there by the AEA. We'll also cover the no room for error, especially when you take into account the Delta variant that's there. We'll talk about the new impact of some of the new Biden mandates in terms of mandates for vaccination and testing. And then we will wrap it back up with some of the safety strategies and really kind of give you some of those ideas on what it is, that reassurance that, this can be done and it can be done safely. It may look a little bit different than what we're familiar with, but there is a way to make it work where everybody is able to enjoy, but also stay safe at the same time. So at this point, let's go ahead and get started with Dr. Cherry. Dr. Cherry, I actually included both LA and New York in some of these stats that are here because I know that we've been tracking both of those very closely. So talk to us about the case numbers that we're seeing and the significance of those would be.
Yeah, so just to orientate the audience to this type of slide, this is an epidemic curve, which kind of shows cases over time. And it's really kind of a picture of the apocalypse, as Molly would say. And so what you can see just broadly from high level is there's really been 3 surges across this pandemic. And what I think is very consistent is what we're seeing right now and what happened to us last winter, where both New York and California had significant spikes. Early in the pandemic, we know that New York was really one of the first places to see a huge surge, where California kind of lagged a while. But I think what you can take from this broadly is that last winter was a really significant kind of surge that was the highest we had ever seen it in the pandemic. And then, both geographies' case count significantly dropped. California got up to 40 to 50,000 cases per day. New York looks to be about 17,000 cases per day. And probably due to a number of things, to include vaccination, temperatures warming, people being outside more, a host of things. The curve was really dropping, and that was really, everyone I think was very optimistic. And I think a lot of people thought it was the end of COVID-19. And then something really bizarre was happening in early summer, where, late spring and early summer, where cases started to come up a little bit. And what you can see here consistently in both geographies is there has been a consistent trend of cases increasing. We're about a third to a half of what the peak was back in last winter, but we are seeing this trend persist more strongly in New York than California. But what I've been tracking very specifically is the UK and Israel. They are going through a very similar kind of outbreak, but they're about 6 weeks ahead of us. So I've been tracking them as kind of a, I guess, canary in the coal mine, so to speak. It gives us early indication of what may be happening for us. And what happened with them was they had a large peak, started to come down, plateaued, and now are trending back up. So it's a very bizarre experience for me as a population health physician to see this happening. But I do think it's due to a number of reasons that we can speak about on the next slide.
Definitely, yeah.
So when what's really changed significantly is the Delta variant from the Alpha variant. And I think what's been well documented in several studies, robust peer-reviewed studies, would be that the Delta variant, when it infects someone, infected personnel have much higher viral loads than they did with the previous variants. And so that really can add to the transmissibility or infectiousness of it. And I think one thing that's now become quite apparent through anecdotes in the news and in studies is that there is some degree of breakthrough infections in those that are vaccinated. And so I think there's a lot of value still in vaccinated personnel because they seem to have a shorter duration of infection. And really the biggest metric that the vaccine companies have provided as really their takeaway is severe disease prevention, hospitalization, and death. And there was very high levels of effectiveness in the early studies before Delta. And I think we still have a fairly high level of effectiveness with Delta. Mind you, though, if a vaccinated person is infected, which is more rare than someone who's unvaccinated, when you look at their viral loads, on average, they're very similar. So if there is a breakthrough infection, that vaccinated person can be as infectious as an unvaccinated infection. And so really this is very complicated and nuanced in many ways, because I think we were thinking that the vaccines were really a pathway to elimination. But again, we are seeing, breakthrough infections. When we look at current vaccination rates, I believe we're hovering right at 50% fully vaccinated in the U.S. And I think also Delta has complicated the picture of immunity, like long-lasting immunity. We are starting to see some studies that are showing waning immunity for those that are fully vaccinated. And actually, the FDA has made put out some guidelines and recommendations about booster shots for those that are fully vaccinated. And so right now, their current guidelines are not to provide a booster for everyone that's been fully vaccinated, but those that are in high-risk groups, those in healthcare settings, all of the vulnerable populations that's defined by the CDC. I'll just, some of the high-level ones are age greater than 65, chronic medical conditions to include heart, lung, kidney, cancer, dementia. And so, again, this remains a very challenging infectious disease to manage.
Yeah, definitely. Several things I wanted to bring up, and Dara may bring you in on this one, is that, I see in our audience that we have those that have joined that aren't necessarily production specific, but we had actually told them about this, and there was a reason why we asked them to come to this and actually join you guys, because they have many questions about what it is that has been going on the production front, why, how the results that have been seen by you guys in your industry, and now we're seeing that roll out into some of the other industries that are there as well, some of the testing and the mandates. For a second.
Yeah, I think, Holly, you cut out for a sec. I was just going to say, we have an interesting mix of people joining us today that include those from theaters and productions, and then we also have a lot of our corporate clients and people joining us today. And one of the things that's really interesting as we roll through potential OSHA regulations is the industries that have been very heavily regulated as they've returned to work over the last 18 months. So the experience we've had, like Tony said, at the beginning of the return to work process for media, we've learned a lot about how to manage the operations of an organization, whether that's for a television show or whether that's for a mining company. We have the ability to kind of think about how we manage safely through this process and the lessons we've learned through that. And it applies, even though Broadway may seem like a far cry from a mining company, there's been a lot of lessons learned through those regulations and how we manage through that and keep people healthy and safe. So bear with us as we kind of go through some of this, but there's been a lot of ways of doing this and keeping people healthy and safe and doing the jobs they all love to do.
Absolutely, yeah. And before I turn to you, Alex, one other thing I wanted to ask Dr. Cherry about was, so I think that one of the biggest realities that we're coming to face here is that there was an idea and this thought that, once we have these vaccines that everything, like I think you mentioned that was the pathway to getting us to where we needed to be, that was going to kind of overcome. But you're seeing a lot of discussion on that. We may not have made that mark there, that this may be something that we deal with for a long term. Is that correct?
Yeah, I think several national public health experts may have even said this is going to be an endemic type of position, which means it will become an issue that we deal with annually. And so that's to be determined, but there still looks like there's new variants of interest being generated that the CDC is tracking, and just seeing how vaccine immunity is waning over time is somewhat challenging. On another note, I think we estimate about 120 million Americans have been infected. So there's about 40 million confirmed cases, but when you look at serology studies that for basically every person that knows they've been infected, there's two others that they were not confirmed with a test, but they do have antibodies which lead you to that. So there are some great studies now that show optimistically that natural infection has very robust immunity. And so I think over time we'll start seeing studies to determine if natural infection immunity is long lasting or if it wanes like the vaccination immunity does. So that may be a key to the future as well.
Yeah, definitely. All right, well, let's hop over to Alex. And I was actually chatting with Alex before we got started, and he was telling me that he went to a production last night, which was so exciting. I know that must be, those of you that are in that area, this must be such an exciting time for you guys to see some of these things returning and life to getting back to what we once knew it to be. So, Alex, talk us through some of these mandate principles and kind of what that entails.
Yeah, so back in May, Actors Equity released their 4 principles to understanding how the how work can continue in union theaters. And those principles were, the epidemic must be under control. And that, obviously, the definition of that is, shiftable and changeable. And depending on how cases are surging in areas is sort of where that's looking, and into contact tracing and all of those types of things that we're seeing most areas talk about when it comes to how are we controlling this epidemic. Individuals who may be infectious can be readily identified and isolated. So obviously that, regular testing, understanding what that means. The way we audition, rehearse, perform, and stage manage may need to change in that some of the things we were doing before, we maybe can't do that we were doing for better or worse. And then finally, that the solution needs to be collaborative, that going through that. So then as we look at this, that shifted as the vaccine became fully and readily available to folks. But those guiding principles still sort of remain in place, just shifting the goalposts with those vaccines. So if you have a fully vaccinated company, which includes not just your Actors Equity members, but anyone who may come into contact with those equity members, whether that's a member of a different union, or if it is, they are interacting with your house management team, or depending on how they enter or exit the theater, anyone who may be having an interaction with those company members, if it is going to be working under the fully vaccinated rules, needs to be vaccinated. And what those rules allow you to do is you can test less frequently. It's still not no testing. It's a once a week testing. It's a check-in, or obviously if someone is symptomatic, that would also trigger a test so that we can make sure that they aren't ill. And then also working, with children under 12. So what we've already started to see, who are not yet eligible for the vaccine, who are not yet going to be fully vaccinated. So as we've seen, productions of The Nutcracker be announced, many of them are being announced without the volume of children that they normally would use, particularly young children. I would also guess we'll see a lot of older Tiny Tims in productions of Christmas Carol as they come back into play. But then you can also work without a fully vaccinated company. However, that does require more frequent testing of the company, a little bit more strict enforcement of your physical distancing and masking requirements. In general, you're still staying masked in rehearsals, vaccinated or not vaccinated. And all of this is being overseen by a COVID safety officer who doesn't need to be a member of the union. In fact, the union was pretty clear that it can't be added to a stage manager's duties. Though I will say stage managers make excellent COVID safety officers because it is, a very similar skill set of keeping folks organized, making sure the rules are in place, and making sure that people are staying safe and following these rules. And especially as we know, we additionally move into flu season and other communicable diseases, one would hope that a lot of these safety principles continue moving forward, even as we get a stronger hold on COVID.
Absolutely. You are exactly right, Alex. Yeah. Was there something anybody else wanted to add to that? I thought I saw somebody's maybe hand, but maybe not. You're exactly right, Alex. And what I did want to ask you, though, was, in the very early stages of the pandemic, and it was like, will we be able to make it through this? Will we ever be able to do what we normally do and do that in a safe way? Does it feel like that people are starting to see, kind of taking a deep breath that, okay, maybe there is a way, maybe there is an option here, there is a safe pathway that can make some of these prior habits or prior things that we had expected, that those can be done again in a safe way?
Yeah, absolutely. I think one of the things, a few points to that. One, there is yet to be a full production shutdown of any show operating on these AEA principles. There have been a few missed performances of particularly touring productions where there's a whole different set of rules because you're moving through different areas of the country. And so as they've started up again, there have been a few hiccups there, but they're straightening those out. But then also as an audience member, Broadway and a lot of other regions across the country are requiring audience members to be fully vaccinated as well as they come in and remain masked during the show. And besides having a mask on, when I was at Come From Away last night, it felt very much like a normal night at the theater going in, which was just a huge return to normalcy that hadn't quite experienced in other areas yet.
Oh, that's awesome. I love hearing that, Zach. Alex, that is fantastic. Well, I don't think that Zach has made it back, correct? He's not back on. So what we can do is actually, I'll just have all of you kind of chime in on this. I think that obviously it's a piece that we're all very familiar with. But what we want to kind of bring up here is that Delta is a game changer in terms of, what we thought was going to work. And I think Dr. Cherry had spoken about that as well, that, we thought the vaccines were the sure way that was going to be our golden ticket here. But now we're seeing that you can have some of this breakthrough infection that kind of comes through. Dr. Cherry or Dara or anybody, you guys want to kind of speak on some of these things in regards to not only just kind of the false sense of security that you can kind of get, but also some of the risks that are associated with that?
Yeah, I'm happy to start off. The false sense of security is, I think, a great bullet point. Obviously, here at Axiom, we live and breathe this for so many months, and I guess 18 months now. But in my personal life, some of my friends that I don't overly speak more technically about my day job, it became apparent to me that they had kind of resigned themselves to the pandemic once they became fully vaccinated. And so I do think the messaging with regard to breakthrough infections may not be broadly distributed. And so that really can allow for a false sense of security. And what we've learned about this pandemic is it's so dynamic, and the world is essentially starving for what's happening. How do we deal with this? And so one of the trade-offs is that the information we have is imperfect. So the vaccines were and are quite effective, but not. We're realizing they don't provide sterilizing immunity, and so you do have breakthrough infections of vaccinated. And then I think with regard to asymptomatic case transmission, that's something we've always been concerned about, even before Delta. But still, there's such high viral loads, even in those who have mild or no symptoms in their respiratory, their nasopharynx, you would call it. There is a concern for asymptomatic case transmission, and I'll let one of the other panels take it if there was something else there.
Molly, I'd love to kind of call on you here as well. Do you want to speak to this as well? Do you have something to add?
Absolutely. So I think for me, one of the things that's really important to remember in this time of vaccination, and then this time simultaneously of Delta and the continuing development of variants, is that when you're looking at your COVID safety plan, you should assume that at some point someone is going to test positive.
Ooh,
and I think
point.
a lot of times when people are thinking about, and you're just like, you're adding a budget item, right? You're just adding, okay, I need a COVID safety officer. I need to figure out testing, like make it happen. And I think the thing that's really important to remember is that you're putting a system in place to take care of people and keep people safe, because we know now that the vaccinations keep people safer. You are significantly less likely to go to the hospital if you are vaccinated and contract COVID-19. However, you're not actually that protected from catching COVID-19, and you're not protected at all from spreading it, particularly in an asymptomatic case, which is why things like stringent testing, making sure that you're testing people regardless of symptoms and consistently, you're able to catch those cases so that it's not spreading as quickly through your company. Because we all know that social distancing in a theater is not really a thing. Okay, it's not really a thing. We're going to try, but like we've all been in the wings. You know how that looks. That's not a thing. The thing to focus on is making sure that we're focusing on hygiene, hand washing, limiting exposure where we can. But you should go into this and create a system with your teams who know what they're doing, who understand how this all works, and assume that at some point, at least one member of your company is going to test positive, and you're going to want to support them through that.
Yeah, definitely. Really good points. Tony, was there anything that you'd want to add to that as well? I know you've kind of been there on the front lines also.
No, and those are great points from Molly. And I think a lot of it is on the education portion. You know, it's easy to say you have to do this, you have to stay distance, you have to wear masks, but if people don't understand the reason why, they're just going to fight it. And when you have COVID compliance officers on sets and stuff, you know, they have a lot of responsibility. There's a lot of things they have to deal with, like the safety plan, like the testing cadence. And it really is on all of the people there working to take that onus on themselves and take that responsibility and do the right thing. And there's so much misinformation out there. And one of the things that I've heard that I love saying is that the science isn't changing, COVID is. You know, we're trying to keep up. And so just like with the Delta variant, Delta Plus, Delta Burke, kidding. With all these different variants, we have to be able to keep up with what's needed with that specific case. So with these breakthrough infections, you know, a lot of times now we're seeing kids, a high level of kids, because that's the demographic that is not vaccinated. If you're under 12, you can't. That's why we're seeing all of these elementary schools that are having these huge breakout cases. I live in Texas, and we get notifications from my daughter's school almost daily that there's that there's cases in these instances. So we just have to really be educated, really make sure that people understand why they're doing and not just barking orders at them. And that goes for not just Broadway and not just production, but on factory lines and in offices and everywhere.
So true, Tony. Absolutely. Well, I'll kind of stay with you here, especially when we kind of get to the topic of what type of impact should we anticipate with some of the new Biden mandates that have came forth, and that we've had those discussions in some of the industries. But what is your take, and how will this impact production, and in particular Broadway, Tony?
For sure. Well, and we're still very early on. You know, we haven't gotten all the finite details on it. For an employer, you know, they haven't said with these companies that have over 100 that are required to have vaccinated employees or weekly testing if the employer is going to be paying for it, if the employee is going to be paying for it. There's a lot of gray area that I think over the next few months we're going to have to figure out. With production specifically, so much of it is guided by the unions, by the guilds, by IATSE, by the Teamsters, by that it really doesn't leave a lot of wiggle room, which is good. You know, it's a very black and white, this is what we're going to do, much like Alex was alluding to. You know, if you're under 12, this is how we're going to do it. New York and California specifically have so many requirements outside of that as well from a state level. You know, both of them are now requiring all live audience members to be vaccinated. If you're 12 or under, you have to have a test within 24, 48, 72 hours. Some are more stringent, some are antigen, PCR. I mean, the list goes on. So it really is, again, identifying what your specific community is. So for live audience members specifically, when you're going to these live events, like in Broadway, you have to take into account things such as your specific community spread. Do you have a lot of cases in your area? Are there all these outbreaks happening? Or do you live somewhere where the cases are relatively low? When you're in these places, is there good ventilation? And this seems, you know, getting a little bit granular, but really, you know, if you walk in somewhere and it's very stuffy, there's a larger chance rather, that there's not good ventilation. That's where spread happens. You need these good ventilated areas. That's why in all of these regulations that are coming out, they're saying things specifically like you have to have MERV 13 filters, or you have to have air scrubbers, or you have to have moving this or that. It's also taking into consideration how long you're going to be in these places. You know, if you're in Broadway, if you're in there for an hour versus a 4-hour German opera, take things like that into consideration as well. So a lot of things that you really need to think about, although it is this kind of return to normalcy. I think that for a while, every time we go to something, there is going to be this sort of pause where we have to dissect what that specific thing is going to be and really, I don't want to say see if it's worth it, but really make sure that what you're doing isn't just because you're sick of COVID and you just want to get out, but because you do truly feel safe, you and your family and your community, that you've done all the things that you need to do in order to do that completely. So moving on to the next bullet point, you know, the vaccine, the testing, screening for patrons, like I said, because of IATSE, the return to work agreement in LA, they used to have the Appendix J, you're not left guessing. So what's made it easier as well is a lot of these states like California and New York have implemented the vaccine passport. Has a very negative connotation. A lot of people are really trying to make it this sort of us versus them thing, and it doesn't need to be. It really is there for a sense of ease. Same with Axiom. You know, we offer our vaccine vault where we're able to do the same thing, and that really yeah, that really gives you the opportunity to not have to carry around this flimsy CDC card that you have to show at all these events. You can flash your phone and it's right there. You're not supposed to laminate these vaccine cards because if you get a booster, you're not going to be able to write on it. So carrying it around is not something that makes a lot of sense, and that goes to, if you're in New York, you want to go to a Yankees game, you have to show proof. You don't want to carry around this card with you all the time. All the bars in New York, you don't want to carry it around, same in LA. So having the ease of these things, using technology to our advantage, there's really no reason to not do it. So that's my opinion on that.
I love that. Yeah.
Go ahead, Holly.
No, go ahead. You go ahead. I didn't mean to cut you off if
no,
you're
you're good.
still
I just
talking.
feel like I'm talking. But also, like Alex said, this isn't just about the people. It's about the audiences. It's about the performers. It's about the backstage crew. It's about the theater staff. It's about every single person. So it's really taking into account all these things. Now, there's only 10 states right now that permit digital vaccine proof. California being one, New York, New Jersey, those areas. Several states have, again, taken it as sort of this issue and passed laws forbidding them. Right now in Florida, you're seeing a big fight between the cruise industry and the government because the cruise industry is saying they want to see a proof of vaccine, and Florida's saying you can't ask for that. It's in the courts. So because this is so uncertain, it really is staying on top of everything. And when you've got people that can help you through this, or companies that can help you do these decisions and keep up with them, it really is almost like having an outsourced HR department because they're dealing with these difficult things for you, and it takes a lot off your shoulders.
For sure. Yeah. You bringing that up, Tony, that's what it brings me back to, is just thinking about the concept of what it is, obviously, that we get to do. And we see the beneficial side is that, you've got all of these complex mandates. And, for people that don't work in those on a daily basis, that can be really overwhelming. I mean, that would be a lot to not only understand, but think how it is that you can incorporate that in your daily operations and how you're going to be able to make it around all of these individual stands that have been put up and objectives that say, hey, you have to do this now versus, it's going to add another 30 minutes to whatever it is that you normally do on a daily basis. So I think that I know for me, and I'm sure I speak on behalf of you guys as well, is that's has been the most rewarding piece here, is to be able to take things that are so complex and break them down into simple, easy to understand steps that you can take, that you can marry the two, that you can bring back life as we knew it, but at the same time, you can do it in a safe way. So absolutely, Tony, great concept, great ideas. And I love everything that you spoke about, especially the process of screening these things and keeping up with that documentation. Good deal.
Hey, Holly, I was going to say real quick before we jump over, I was thinking a lot about fatigue. I've been talking to a lot of our clients, both on the corporate side and the media side. And I think we've talked about this a lot today already, but not letting that sense of wanting to get back to normal and normalcy get in the way of doing the right thing. And I think we've all hit on that numerous times. So I wanted to point out and just say, I hear it day in and day out, how fatigued some of these safety teams are, some of these employees are with having to check in every day. And it sounds like that's not going away anytime soon, having to test on a regular basis. And everybody is really tired of this, especially those industries that have been operational this whole time. And what I was thinking as you were saying that, the unions associated with media and entertainment have delegated an entire role for COVID health and safety. But as you were saying about HR departments struggling with all of these new mandates and new regulations, a lot of our safety directors that are in the corporate side have now added COVID health and safety on top of their safety role that they already had in preventing injuries and exposures and all of this other stuff that they're being tasked with. And then all of a sudden, infectious disease got added to their to-do list. So we have not just fatigue in general, but our teams are really tired of trying to pivot and create good policy and process to keep people safe. So there's, not to say that I have the magic answer, but that's one of the reasons we keep talking about all of this, is that by talking about it, like Tony said, education is critical, getting the why behind this, and thinking of ways we can highlight these employees that have been doing the right thing this whole time as real heroes in the U.S. and in keeping things moving and operational is something that I know Holly and I have been spending a lot of time thinking about. So I'll stop talking and we can move on to Molly.
Definitely. Yeah, Molly, let's head in your direction. We'll head back there and maybe kind of talk us through some of the lessons that you've seen, especially being there on hand, what you're seeing, what works. In addition to that, kind of some of the challenges that could be on the horizon there, especially with testing and some of the mandates that come along with that.
Absolutely. This ties really well, actually, into what you guys were just speaking about, because I think the most important thing is to help the crew, cast, house staff, whoever is on your production, to understand why the rules that are in place are in place. Like, where does each rule track back to in terms of how it's keeping you safe? Because a lot of times, especially if the rules are coming down from the unions, it can create this us versus them mentality, and explaining to someone, okay, so welcome to this show. I'm your health safety supervisor. I'm going to tell you what happens if you test positive. I'm going to tell you how you're going to find out, what's going to happen to you next, who you're going to call, what you need to do. Can you leave your house? Can you not? Who do you have to talk to? Like, really, really helping people feel taken care of. Because when someone tests positive, and I have had to be the person to tell lots of people that they have tested positive. People have a wide variety of reactions, but in general, finding out that you have tested positive for this thing that has existed in the news and the ether and in our world as this very scary entity, making sure that your policies are explained to people from the start so that when they find out that incredibly scary news, they know what's going to happen next. I think that's my biggest lesson in terms of how to get compliance, how to get people to understand that, like, I'm on their side. I'm there to support them and help them and keep them safe. If someone else is not wearing their mask, they do not have to be the bad guy. Come and get me. I will talk to the person who's not wearing their mask and help them understand why I want them to wear their mask. Are they not wearing their mask because they're wearing the wrong kind of mask? It's uncomfortable. Let's talk about it. Let me explain why this mask is better than the mask you think you saw on Facebook is better. And making everything a conversation. Making sure that I have a direct relationship with every single person who's working on my show. If that's a teamster, if that's a lead actor, if that's a door security person, I want all of them to know that as the health safety team, myself and the rest of the people on my team are there to be in direct conversation with them to keep them safe. One of the things that happens a lot is there's a group of people, right, the cast, who are allowed to take off their masks. And sometimes there's this sense that there's a hierarchy because the people who are allowed to take off their masks on a film set, if you're around those people while they have their masks off, you have to wear eye protection. And people get really annoyed about that because eye protection gets in the way of them doing their jobs. The thing that I like to explain to people is that eye protection is not actually there to protect the actor or the maskless person from you. It is there to protect you from them. Because the most dangerous time on any set is when people take their masks off. That's the highest risk moment. So we are trying to put things into place to keep everyone safe. It is not about letting an A-list actor take off their mask whenever they want. It's about safety. And I'm the person who's there to explain to you why I'm asking you to put on your goggles is because I want you to be safe. So making sure that people understand the why of the rules is so important. And understanding the why of the rules is my job. I worked on a few productions before I joined Axiom, live capture of things, where I was the person who was learning the mandates for the first time and absolutely in over my head, up late at night, scrambling to understand these things. And I know so many friends right now in the industry who are deciding to come back and start a production, and it's overwhelming, these mandates and what they mean and how they work. Having a team who has done this before, and having a team that I can go to be like, so-and-so just said this on a set. Have you experienced it? What does it mean? Like, knowing that every time you're asking a question, I'm not gonna answer if I don't know. I'm gonna go find the answer. And I'm gonna find the answer from a group of people who have been doing this for over a year. COVID is not new. At this point, COVID is not new. It might be new to your company. It might be new to your industry, but it is not actually new. There are people who know the answers, who have been doing this, who understand how it works. And I think that's the difference between independent COVID management and knowing that you're hiring a team. Because there's a scrambling that there doesn't need to be when when you're just figuring out for the first time, to keep everyone safe. Like, what does COVID testing even mean? With Axiom, we have COVID testing events. You tell us who needs to test, we'll help you figure out when, and we will have a dedicated tester who will test your people. You are not sending your casting crew scrambling all over the city, trying to find a clinic that gets their results back in the right amount of hours and is the right kind of test, and getting a handful of receipts that then you have to figure out. Like, we have it. We have the system. We're going to take care of you. I think for me, knowing how it's working on a lot of productions right now versus knowing how it's working on the productions that I'm on, seeing that stress level be higher than it has to be, particularly in test kit sourcing. Right now, the AEA guidelines allow for antigen testing as well as PCR testing. The SAG-AFTRA Safe Way Forward guidelines, which are in conjunction with IAPSI, do not allow for much antigen testing. They're a little bit more specific. I won't bore you with the details, but I know them and I'm happy to talk about them. But basically, a lot of folks are relying on antigen testing, which means that there's a really big shortage of antigen tests in the world. And I know that there are health safety supervisors who are working independently all over New York right now who are sending friends and family members to buy out the shelves of Walgreens. And aside from the fact that antigen testing is significantly less stringent and is not my favorite form of testing, it does have a place on a production with the right understanding of how it's being used. And we have access to those tests. You're not ever going to be sending out a PA at 7 in the morning to like scramble all over the city to buy as many Binax whatevers as they possibly can fit in their tote bag. It's just a matter of like having systems that you can trust from people who know what they're doing. I think in theater, we're really familiar with like getting it done, whatever it takes, one person department just figuring it out. And I think when you're dealing with safety and people's health and safety of a highly communicable disease, this is not the time to scramble. And
Right.
You should go into your protocols knowing that at some point, someone you work closely with and care about, because in theater, we work closely together and we really care about each other. One of your friends is probably going to test positive. You want to know that you have the right people to take care of them. I actually like the part of my job where I have to call people and tell them they're positive, because I would much rather be the person notifying them. I know that sounds so weird and macabre, but I would much rather be the person notifying them and knowing I'm answering their questions and supporting them through that scary moment than them finding out from an app or a PA or a voicemail or something else that's not HIPAA compliant. I would much rather know that I'm the person they can have a conversation with and know what they need to do next. And that's what a good safety team can give you, is security, simplification, systems, and like compassion, honestly, that we're not just a budget line item.
You're exactly right, Molly. You're exactly right. Such good points. And you know, I really quite like what you said about that. We're people individually, that you're dealing with somebody that we understand what you're going through. We know what you're going to face, and it helps to be somebody that has some additional knowledge there that can communicate that in a safe way and just kind of reassure you that you will get through this. You definitely will make it through. So excellent job, Molly. I know we're kind of running low on time. So Dara, I did want to ask you if you'd maybe kind of just go through, some of you may be familiar with Axiom. You've heard about these, our protective stance here and why it is that you want to include multiple approaches in everything that you do and all things COVID safety. So Derek, would you just kind of cover this real quick and explain the various pieces of this and why it matters that you have all of them?
Yeah, thank you, Holly. Like I said, our industries that we've been supporting have been maintaining operations this whole time, before testing was widely available, before vaccinations were there. So when we think about a layered approach, we think about all of these working together to keep people as healthy and safe as possible. Like Molly said, you're going to have people positive in the workforce. It is what it is that we're dealing with, but it's how do we keep these layers in place as much as possible to keep everybody operational, whether it's in the theater, whether it's any of our corporate clients. And all of those stacked reduce the risk. And that's really the goal here. That's really what we're trying to approach, is not zero risk, but the lowest risk we can manage through a pandemic. So before we even had testing available, we were keeping operational with all of the other components, making sure that people are taking care of their PPE, that they're doing assessments, that we're case managing positives and contact tracing. All of those pieces kept everybody moving. And then we add testing and vaccination as new layers as they become more available and more readily available. And I do think that what we've found is by doing this, we can help everybody stay as healthy and safe as possible. It is never perfect. It's never 100%, but it is as best as you can get to 100%. And so I think not losing sight of what Molly said, that systems, all of this needs to be in place in order to protect the people and the individual. So that's our main focus in approaching it this way, and making sure that we've got the layers. We keep assessing the layers to make sure they're the best. So if it's new tests available, new vaccines available, all of this is something that we as a team continuously look into to make sure we're providing the best of the best to our clients and their employees. It's been a rough 18 months for everybody. And it is something that we want to just keep reiterating, because it's easy to forget a layer. It's easy to ignore a layer, but we need those layers in place to keep us healthy and safe.
Absolutely. Yeah. And Alex, I know that we kind of talked through some of these that were already there, especially, we've spoken a lot about the why the why matters. But one thing that we didn't talk about a lot was this issue of how it is that you're supposed to, how you can market some of these safety strategies that you have to kind of give those that are attending your shows, the patrons or whatever it may be that's coming, how it is that you can communicate to them in advance of what the expectations are. That way that they can feel confident, but they also have an idea of what's expected before they arrive there on site.
Yeah, absolutely. I mean, the first thing I would say, as with communicating any policy to your audience, is that never assume they're going to read the thing you sent them. So send it in multiple forms, have it everywhere that your press release is going. And also train every single member of your staff on the talking points so that they can always answer that question readily. And one of the things that is important with that is, one, survey data from a couple of different sources suggests that the majority of theater-going audiences in particular are in favor of vaccine mandates. That, it's about a 60-40 split-ish right now, continuing to go higher and higher as vaccines become more widely instituted. And then also pulling out something that Molly said earlier, assume somebody in your cast and crew is going to test positive. If you're explaining to your audience what your procedures are and how you're dealing with those types of things, it offers them more assurance that even in the worst case scenario, the show will go on. And they will be safe coming into this building, because we don't have somebody who has tested positive running around the building. We have rechecked everybody. You're coming into a safe environment, and so confidently buy your ticket, confidently come sit in your seat, especially as your standard theater goer is in that higher risk population, tends to be older, and that skews to more potential comorbidities of the audience. And so finding that confidence is really important.
So true. Yeah. I know that we've kind of gone through this fast and furious here at a fast pace, but we did have a few questions I wanted to just kind of ask you guys that we could pick up. I think we answered some of them that were in the queue. But just quickly, I think Linda had she was asking about which should be used for pool testing. So she was wanting to know, would that be antigen or the PCR? Does anybody want to take that question?
Scott, I don't know if you want to talk about pool testing. Go ahead. Sorry.
Yeah, pool testing is a way to kind of preserve testing resources. So the idea is you take lots of samples from people and then test it in a large batch format. So really you need kind of a low prevalence or low expectation of a positive, because you do need to go back and test everyone individually if you do get a positive. So if you have now during the surge may be a tough time to do that. But that's kind of a nuanced decision, but I would say probably PCR testing is probably the most beneficial for that.
Gold standard, yeah. And I saw that Joe had spoken up as well and asked for contact tracing, how many hours after the performance should we ask the audience to notify us?
So for contact tracing, I think that question is asking what if they test positive 3 days after the performance versus 4 days after the performance. And so we typically look at the time frame that is 72 hours prior to when someone tests positive, because you can be contagious prior to testing positive. So we would ask anyone if they have tested positive 72 hours after. If they attended a show and they, yesterday and they test positive today, you want them to call you. We're looking at a 72-hour window of potential exposures prior to when someone knows that they're positive.
Yeah. Okay. And I think I saw something from Heather as well that was asking, with the weekly testing, can you exclude those that have tested positive within the last 90 days?
That's a great question. And yes, per the CDC guidelines, if you've tested positive within the last 90 days, you would not be required to test unless you become symptomatic. And that's basically etched out in all of the return to work protocols. And it should be the same for anyone else.
Okay, good. Let's see. Anthony was asking if we could clarify on the FDA booster recommendation. So they wanted to confirm that this is only for the age 65 and high risk. So maybe those that would have a pre-existing condition. Would that be correct, Dr. Cherry?
Yes, but I would maybe just caveat it to take a look at that list, because if you actually look at that list and you look at the health of our nation, a lot of our nation may actually qualify for that on some of those, but it is not a general recommendation for everyone to get the booster. Mm-hmm.
Okay.
And it is only Pfizer right now. I think that's one of the things Anthony is asking about, is that that's only currently approved for the Pfizer vaccine, not for any of the others.
Right.
Correct. Yeah. Yeah. And I think Adam was also asking, let's see, what does regular testing mean? And what would it require to conduct? So I think the question was, do I need to send each of my employees to a clinic? Molly, I think you may have covered that.
It's a very nuanced question. Tony and I both work a lot on production, so we know, but basically it depends what union guidelines you may or may not be under. It depends what state and city guidelines you may or may not be under. In general, there are guidelines that dictate once a week testing based on someone's union affiliation and production responsibilities. There's 2 times a week testing. There's 3 times a week testing. There's guidelines that require daily testing. It really does depend on the unions you're under and your location, and then how secure you want to be. Do you have to send all your employees to a clinic? Not necessarily. If you work with someone who has a dedicated staff, we can set up a testing event for you.
Mm-hmm.
And for those of you that are, and for those, I was just going to say, for those of you that are outside of production, you're also going to take into account what the job is. You know, if you've got people that are in an office that aren't so close to each other, it's probably going to be more of a once a week. If you've got a bunch of people that are loaded into vans and you're going out to sites and you're sharing, you know, all sorts of areas, that's going to be a more frequent, maybe 2 times, 3 times a week. And it doesn't have to be a clinic test. It can be an antigen test that you result in 10 or 15 or 20 minutes, but it just does give you that knowledge that at least the people that you're going to be sharing your time and environment with are negative.
Yeah. Good
information. Yeah, I was going to say the same thing. A lot of it's just to be determined with the new OSHA guidelines too, because it'll be based on vaccines. So what we're recommending for employers to do is start gathering the vaccine information now with their populations so that they know what their testing population looks like. And if it passes the way that Biden came out with it, it would be excluding that vaccinated population that's fully vaccinated, and then you would have a weekly testing cadence for the non-vaccinated population. Also, a lot of our clients do test, I think Molly said this, if you're symptomatic as well, because especially as we're hitting flu season, like we've all said, we've got tests that can actually, with a single swab, detect COVID, flu, I believe strep, and RSV. And so as we think about those other infectious diseases in the workplace, it's something that we always reiterate with our clients. I know the production clients, it's something we try to keep in the front of their minds too. Just because it's not COVID doesn't mean we want flu and strep on site either. And we have to be able to differentiate because there's potentially a faster return to work protocol for somebody with the flu versus COVID. So I'll
Excellent
stop there. I know we're out of time, Holly.
Sure. Yeah. No, I thank all of you for participating today. I think it was a lot of great information. I think all of you who had joined us, I hope that you've gotten some good takeaway points there. Obviously, if you have additional questions, we're always happy to help you with those. You're welcome to send something in the chat, or you can reach out to us. Either way is fine. But again, we appreciate you coming. If you would like to download any of the references that we talked about, the new guide, the vaccination guide that's for Broadway, you can do that right there in that resource tab, along with some of the other guides and resources about dealing with the flu and the pandemic, some of the other technology pieces that would make your life a little easier as well. So anyways, anything that we can do to help you, let us know, and we hope to see you soon. Thank you.